Great. Thank you very much, George. It's a pleasure to be here. I do feel like I should report that Ray was in the gym this morning because he was right next to me. So he definitely got his 30 minutes in. The second thing is it's great to be here with all of you. I'm on the Obesity Roundtable with the Institute of Medicine. The biggest difference I think I see so far is that I'm now wearing a yellow name badge instead of a blue name badge, but I'll work to try to be comfortable with that. I also felt like I should do a warning about my presentation. Anytime I've seen IOM presentations or participated in them, they're very erudite and data-driven, and for mine, you're going to see a lot of pictures and a few videos. I don't feel so bad, given that Ian showed a video, although you did have a complicated slide, so it kind of balanced out. But that's what I'm going to show you a little bit about what the Partnership for Healthier America is all about. And our theory of change with PHA was really that there are a number of different factors impacting the obesity crisis that we see. There's need for public policy change. There's need for better public education. But one of the areas that we felt that there was big need for and sufficient opportunity to make an impact in is working with the private sector, which is, after all, where people are purchasing their food and utilizing to become physically active in many cases, or going to use health care or child care, whatever the case may be. And so I'm going to show you a number of examples of the sort of work that we're doing, which is really all designed to make the healthy choice, the easy choice for American families. Separately, before I came to PHA, and I won't be covering this on my presentation today, but I'm happy to answer questions about it, I worked at the Juvenile Diabetes Research Foundation, where we also engaged in public-private partnerships, which are really of a different sort. They were designed to work with pharmaceutical companies with the charity to de-risk investment into development of pharmaceutical drugs that would benefit a certain population that's not as big as what might otherwise drive drug preparation. So very different approach that we took. So this first video I'm going to show you, if we can get that started, and I'll talk about it in a second.
Fix everything I did bad.
I would bring my uncle back because I miss him very much.
I would get more hamsters.
I would probably want to go looking for dark matter. I think I'd go looking for aliens. If I could live an extra 5 years, I was thinking about making like a helicopter, like a wooden helicopter. I don't know any wood.
I was gonna go check out the moon sometime.
I'd probably teach my sister not to hit tuna.
I would try and invent a machine that lets you learn at light speed.
If I have 5 more extra years to live,
I would be the boss of all the chipmunks.
it would have nothing to do me to the solar. I don't really know. I think I'd do anything.
Why are you asking me that?
So I love that video because it's so powerful and catching in so many different ways, but one of the reasons I showed it to you is because it was a collaboration of a number of different organizations. In particular, Nike produced this video, and you can see the use of this in trying to drive our issue. But what's really interesting is what was driving Nike's involvement in this collaboration was very different from what was driving PHA's involvement, yet it worked for both of us to work together on this. Nike was interested in solving the physical inactivity epidemic, which is related to obesity. We're interested in solving the obesity epidemic, but figuring out a way that we can work together, and it led to this Design to Move collaboration, and I'll talk a little bit more about Nike in a second. Three other things I want to say about working with the private sector, some of the watch-outs that we have. Number one is one of the actually, one of the great things about it, two great things. One is that they're voluntary agreements that we're negotiating with industry. So we're not dealing with having to get things through legislation in a time when legislation is very difficult to get to, having to fight either during the process or after the process in court. The impact can begin immediately, which is very positive. But that does bring a few watch-outs, which is we want to make sure that the agreements that we develop with industry are not too easy. They need to be meaningful, and we don't want them to be a replacement for regulation that would be more impactful if the regulation is realistic. The other watch-out, and I'll talk about what we do here, is to make sure that there's accountability in the system. And all too often in these types of work, the accountability tends to fall outside of the core work that's happening. So our process is developed to try to ensure that commitments made are commitments kept. I'm going to skip the facts about childhood obesity because you know it. I think you also know that we have finally some positive movement in childhood obesity, so we're very excited about the beginnings of our work here. Let me talk about this slide a little bit because this does explain a lot about the thought that we go into to develop our agreements. The first is that it's very difficult to actually get an agreement through working with PHA. We are purposefully difficult to work with. It actually surprises sometimes when the media come in and they say, you're just like teeing up these really easy softballs for the First Lady to get credit for. That's actually not the case at all. Very few actually make it through our process, and you'll understand why in a second. Number one, we ask for significant, meaningful business impact. Often companies come in and we talk about what they could do. It's not nearly significant enough. We can't move forward. Our process requires that we have clear metrics agreed to by both parties on exactly what is going to be measured, and they're signed by both parties. We lose a lot of agreements based on that. A lot of companies come in thinking that we're going to do a press release and that's going to be it. Once they actually have to sign on the dotted line, it often brings a more detailed discussion of exactly what do I need to do, how do I need to do it. As I mentioned, we have public accountability. We report on an annual basis every year what each of our partners has done or has not done. It's all available on our website. You can keep track of it. We just released our last annual progress report a few weeks ago. So it's a very that can be a very difficult conversation when you have a partner who's tried hard, has not done so well. Sometimes it's really because business didn't work, CEO changed, and they wanted to go in a different direction or whatever. But what we try to do in transparency is to report whatever happened. We also use outside verifiers to do those reports to make sure that we are really reporting accurate information. So this is kind of the process that we go through internally when developing our agreements. Usually internally we're figuring out what are our goals for the year, what do we want to accomplish, what do we think we can accomplish, what can be the most meaningful. We're not a big organization, so we try to work with large organizations when we can to try to scale our work. To the extent possible, and it's not always possible every time, we try to focus as much as we can on communities that are in need, communities of color. Sometimes, as you'll see, we've had to start without impacting communities of color because it's been too difficult to get those private sector organizations to be interested and develop some momentum by which then others kind of come on board and we get more parts of the community. The negotiations go through, sometimes they're very lengthy. We've had with one of our major partners, it took over 18 months to develop an agreement. Other times it goes much faster. We work with our board to approve or not approve that work. Finally, we try to lift up these announcements for really possible for success and give some PR boost to the companies. I should also talk a little bit about kind of our frame and work with companies. We want these initiatives to be profitable for the companies. We want them to be successful for the companies. We want to help them be profitable. If they're willing to make change that helps health and we can help them make it profitable, that's what we want to do. Because if they're not profitable, they're not sustainable. So we're not seeking charity as much as we're seeking sustainability and success for our partners. So we mentioned that there's 150 private sector partners. I'm not going to go through these. I can answer questions about any of them, but we've spent a lot of time in healthy food access. All these folks are either building grocery stores or bringing healthier options into the stores that they have. We work with different community organizations in a variety of ways. We've been active in health IT. To EHR vendors will have healthy weight programs for children. Early childhood education I'll talk about in a minute. That's been a big focus of ours, and we've been happy to see some movement in the rates, success in the rates there. Reformulating food and beverage, another big area. All these companies have worked on that. Hospitals, which I won't talk about. Gary's got a broader hospital program that he'll spend time on, but when physicians stopped smoking in front of their patients, that was an important advance in public health. When hospitals stopped selling French fries and hot dogs and pizza, we think that's going to be a very positive thing, and it's catching on. And finally, college campuses. This is our newest initiative, and we've been working with community colleges, historically black colleges, large state universities, et cetera, because we think that when students are in college, that's a very important time for them to go through a transition where they are on their own, and we have colleges that are stepping up. And finally, affordable housing developers is our other newest initiative, making affordable housing developments more physically active and better communities for the people who live there. And physical activity, which I mentioned with Nike, but you can see we have a slew of programs and organizations that are funding increased programs in that space. So let me talk about early childhood education, because this is one of the ones I'm the most proud of, and we've now worked with these large private players in ECE along with the YMCA, and each of them have agreed to essentially the same standards, which are things like providing a fruit or vegetable to every meal, no sugary beverages, having water available, making it easy for families to breastfeed and provide those to their families, limits on screen time, minimums of physical activity every day. And what was interesting about this was they all didn't come along all at once. And in fact, it was hard to get some things going. But once we got the first one on, it became a competitive advantage for that company. And the others came on as well. And now it's we've got the largest providers. And we know that if we can keep children healthy before kindergarten, that's going to make a big difference in their ability to not have obesity for their lives. The other kind of large one I want to talk about, and how we can work with large companies and try to get sort of additional progress down the line, is the agreement that we developed with Walmart. And you can see the different aspects of the agreement. We know that lots of Americans are going to Walmart every week. They certainly have a number of low-income Americans are going there as well. What's really interesting about this is one of the parts of the commitment was to reformulate the food that Walmart sells, their packaged food. This is not only the Walmart their own branded foods, but it's also working with their suppliers to change the recipes to lower sugar, fat, calories from those products as well. And so that's going to impact not just at Walmart, but all other stores as well, as Walmart uses its volume power to be able to drive the change beyond Walmart itself, which is pretty big. I wanted to share this article because I felt like when I read it, it was kind of interesting. At a time in Washington that it's never been more difficult to get some things done. You can see the fights that we're having about school lunch, which I'll save my comments. But some common sense advances are difficult to make happen. More and more people have been looking at these sorts of strategies as a way to get things done. And this is the LA Times, which talked about the work of the East Wing, the First Lady, and the corporate work that we do with her as being something that the West Wing should be looking at. So I think this is really moving. So the other thing that's really helped us is that this isn't only we're certainly well situated, having the First Lady, who's very popular, to help us. That's a big part of what we're doing. But we've also had a lot of support from really just consumers. If we had gone to some of these companies 5 or 10 years ago and asked for these changes, they would say, we'd be happy to make these changes, but nobody wants to eat them, eat the food that we're making, or have these changes. But now with millennials changing, we've got a lot more wind at our back in this sort of work, which is making the partnerships a lot easier, a lot more sustainable, even beyond the administration. This is just some photos from the Nike announcement, and I just want to include this because you can see, especially in that second photo, the different celebrities. It's kind of hard to see that are there, but you saw Serena Williams and Colin Kaepernick and Bo Jackson, Gabby Douglas, all these different celebrities. But being able to work with the companies and provide a lot of PR lift is really important. And Nike's commitment was to provide $50 million in support for physical activity programming, including $10 million in support of Let's Move Active Schools, which is a separate program that we're working on. And utilizing the star power of First Lady and others, getting national attention for the companies is very important to be an incentive for them to make these steps. Not that that was why Nike did it, I don't think it is, but it is always really helpful to draw attention to the work that they're doing. So I'm going to show this video in a second. This is my last video, I promise. But this is another way that we have begun to work with partners, and a really interesting opportunity for us to bring different people together. So let's show this video. So this was announced at our summit that we do every year. We did it earlier this year. We just launched this in 2 pilot markets, Fresno, California last week. We'll be in Norfolk, Virginia this week. And what we thought was, if we were Apple or Nike, how would we go about selling a great product? We know we have great products with fruits and vegetables. And if we were Apple or Nike, what we would do is we'd get celebrities, we'd get athletes, we would do endorsements, we'd have cool advertising. We wouldn't just talk about the fact that you need to eat them, they're good for you, have 5 a day. We would go after the greatness of what fruits and veggies are. And so what we've done now is we brought together a number of partners, including Kaiser Permanente, and you saw on there WWE, Robert Wood Johnson Foundation, Avocados from Mexico, Produce Marketing Association. And we're able, because we're a nonprofit, to sign up. You saw a group of them, but we now have over 30 athletes and endorsers who are going to be part of Team FNV and help us bring that to the American families about how great fruits and vegetables are and creating a new brand for fruits and vegetables. So we're going to be measuring the results on that. We'll see how it goes. But I think it's a really interesting way that it would have been very hard for the private sector itself. They haven't been able to pull themselves together to do that in the fruit and vegetable industry. They've tried. But having a group like ours as glue to do that has worked pretty. We'll see how it works, but it's had a good start. This is our annual progress report that you can read about on the web. And I'm going to close just by sharing some kind of common elements of success, lessons learned. Number one, the importance of having metrics in these agreements is absolutely critical. Everything in writing, everything signed. Not be afraid to focus on profitability. It helps us when we can speak the same language as our corporate partners. We want them to be profitable and successful with healthier choices. Critical that everyone understands at the beginning what the accountability process is. Whatever accountability process you choose to use, that shouldn't be a surprise at the end. And I'll tell you, some of our early partners were quite surprised by the extent to which we looked at their information and published it and really held them accountable to everything they said they were going to do. Fourth is it's really important to have support from the executive leadership. It's not really a surprise from the company. One of the watch-outs is that it's really difficult. So many of these companies have CEOs and presidents and other senior leaders who are moving in and out of jobs all the time, trying to keep the momentum. That's why it's important to have these things signed. Last couple of things. We've learned that it's the companies need help from us and often to get through these agreements. So we've had to develop a lot of technical expertise and offer it to the companies to help them when they hit roadblocks that we would have thought maybe in some cases they would have been able to sort through or had that expertise on staff. The other thing is what we do now is we make sure we fully understand at the beginning of the agreement exactly how the company is going to successfully complete its agreement. At the beginning, we just sort of signed it, agreed to it, and then it became difficult. So now we do that up front, and we often help them see through potential roadblocks they may come. So I think with that, I'm going to close and look forward to Q&A.